Organ transplantation is one of those things that feels like pure science fiction, right? It's a real life second chance. But here's the thing. Getting the new organ isn't the finish line. Nope, it's actually the start of a really complex, lifelong journey. So let's dive into what that journey actually looks like.
Okay, to really get why this is such a big deal, just look at this number, 90%. For kidney transplants, the 1-year survival rate is over 90%. That is just incredible. It shows you how far we've come. But, and there's always a but, it comes with a pretty big catch. And this right here, this is the central conflict of our story. On one hand, you have the promise, right? A new organ, a new lease on life. But on the other hand, you have the peril. And that peril is your own body, which has this amazing defense system that is literally hardwired to see that new organ as a threat and, well, destroy it. So how on earth do you solve a problem like that?
Well, you have to find a way to negotiate with the body's ultimate gatekeeper, your immune system. For any transplant to work, doctors have to convince this super efficient, super powerful security force to just stand down. And that strategy has a name: immunosuppression. Think of it like a delicate truce that's brokered by some really powerful drugs. The whole point isn't to completely knock out the immune system, because, you need that, but to just dampen its response enough so it learns to accept the new organ. It's a fine line to walk. So how do you actually achieve this delicate peace? Well, doctors use a really carefully planned 2-phase arsenal of drugs. This isn't just a one-and-done solution. It's a whole campaign designed for both the immediate aftermath and the long, long haul. First up is what's called induction therapy. You can think of this as just overwhelming force right at the beginning. It's a really powerful wave of drugs given right around the surgery to stop an immediate all-out attack on the new organ. Then, once that initial crisis is over, the patient shifts to maintenance therapy, and that's a daily cocktail of drugs they'll take for the rest of their life to keep the peace. And this maintenance therapy is a super strategic, multi-pronged attack. See, it's not just one drug. It's a combination of different kinds of drugs that all target different parts of the immune system. You've got some that stop immune cells from multiplying, others that calm down inflammation. It's a whole web of defenses working together to stop the body from rejecting that organ. And this little fact just perfectly sums up the day-to-day reality. The complexity isn't just about remembering to pop some pills. It is a total lifestyle change, where something as simple as harmless as a glass of grapefruit juice can totally mess with your medication levels and put you in real danger. It takes constant, careful vigilance every single day. But what happens if that delicate truce breaks down? Because even with the best possible management, the threat of rejection is always there, kind of lurking in the shadows. And rejection isn't just one thing. It can happen on different timelines. You've got hyperacute rejection. That's a catastrophic failure within minutes or hours of the transplant. Then there's acute rejection, which can happen in the first few weeks or months, but it's often treatable if you catch it early. And then there's chronic rejection. That's the slow burn, a simmering attack that can damage the organ over months or even years. The fight, it really never ends. So this all leads to a really important question. We have all these amazing, powerful drugs, and we understand the immune system better than ever. So what's the single biggest obstacle that gets in the way of a transplant succeeding long-term? Well, the answer, as it turns out, isn't just about biology. It's about the person right at the center of all this and the incredible lifelong commitment that's required of them. And here it is. One of the single biggest threats to a transplanted organ is something called non-adherence. It's the simple but also incredibly difficult act of not being able to follow that complex medical plan every single day for the rest of your life. And the scale of this problem, it is absolutely staggering. When you look at the studies, the rates of non-adherence among transplant patients are anywhere from 2% all the way up to 68%. That huge range tells you just how tough this journey is for so many people. So why? Why do so many people struggle with this? Well, it's really a perfect storm of challenges. The drugs can have brutal side effects. The cost of all this care can be just crushing. Other illnesses can pop up and complicate things. And honestly, just the sheer complexity of it all, it can be an incredibly heavy weight to carry day after day, year after year. But here's the good news. Patients aren't just left to fight this battle on their own. This is where their support system, especially nurses, becomes so unbelievably important. They're not just giving out medicine, they're educating, they're motivating, and they're helping patients build the personal coping skills they need to actually succeed for the long term. So we're left with this thought. A transplant is an incredible gift, a true miracle of modern medicine. But keeping that gift, well, that depends on a daily, relentless battle, not just against biology, but against the challenges of being human. And it really makes you wonder, as the science gets better and better, how do we get better at supporting the person at the very heart of it all?